So now we're following along with the worksheet, all right? So what is sciatica? Anybody know what sciatica is? Anybody want to give their, yeah, go ahead.
It's a nerve.
It's a nerve, yeah, sciatic nerve, okay. So then what is the actual sciatica pain then? What happens to the nerve when you have the pain? Does anybody know that? It pinches, yeah, very good. So it gets, so when she was saying that I start to get it down my leg, that's a sign that that nerve is getting irritated. Okay? So the sciatic nerve is the largest nerve in the body. All right? It actually splits into two. So the sciatic nerve is the largest nerve in the body. It actually splits into two. I'll let you all write that down there.
What did you just say?
The sciatic nerve is the largest nerve in the body, and it splits into two nerves. All right? And then once y'all are done writing that, I'm going to have you look up, and I'm going to kind of show you where it starts and where it splits. All right? So, it travels from your low back. Now, you have two sciatic nerves, okay? We'll just stay with the right side for now to make things simple. It's a bundle of nerves that travels from your low back down your leg, right about here, a couple inches above the knee, it splits into two nerves. And then one travels on the outside, and one kind of travels on the inside. Any questions about that? So that's why sometimes people that have sciatica pain, they say, the pain goes all the way down to the outside of my foot. It goes up. Some say, oh, you know what, it goes to my big toe. It goes to my big toe. So when it splits, it depends on what level is affected. You will feel pain either on the outside of your foot or more toward the inside of your foot. Go
I
ahead.
have a question.
Yes?
Does it always radiate from the back, or can the nerve hurt at another point, say at your ankle?
Typically not. Typically not. If you have ankle pain, it could be from your back. You may just feel it in your ankle. I've had patients that come in with ankle pain. They look like they've sprained their ankle, but in actuality, they've kind of injured that nerve a little bit. So typically, it's going to come from your low back or from some tight muscles in your hip buttock region. Okay? Good question, though. Good question. So it is pain running down your leg that's caused by a problem in your back. All right? So who's had the burning hip syndrome? The burning hip. And you just feel it in your hip, right? Sometimes you don't feel anything in your back. But then once you start to move your back, you feel like, oh, there's a little pinching, there's a little tightness. That's where that burning in the hip's coming from. Okay? Go ahead.
Which is the best machine to try to avoid that nerve pain?
It all depends on how you present, because everybody here has a different presentation of their back pain. She had trouble getting out of bed in the morning, but she does fine walking, which is great. Some people can't sit for a long time. Some people can't stand for a long time. So it's more about your posture when you're using the machine than the machine itself. Does that make sense?
I feel better when I'm on the elliptical than
Okay.
the treadmill.
Yes.
I feel it completely.
The elliptical it takes stress off. You're not doing the pounding of the running. Not that running's bad for you, but if you have a back problem, it's probably not something you want to do. You know. Does that answer your question?
Yes.
So the question was, what machine is best for you? I would say if you work out and you want to be active, do what is most comfortable for you. Don't push through the pain. Don't say, well, my doctor told me I have to walk, I'm going to walk, but my pain flares up every time I walk. We need to find something else for you, and that may be a stationary bike. Okay? Good question.
Can walking on concrete make it worse?
Can walking on concrete make it worse? I would say as long as it's an even surface, no. It's not about the hardness of the surface, but if it's an uneven like concrete where you're kind of stepping in potholes and you don't have good control on your low back muscles, then yeah, I would say that would affect it. But if it's just carpet or concrete, it's not going to make a huge difference. Yeah. Okay? And again, it's more about the position of your back when you're doing the activity. And we're going to go over that, okay? Great question, though. Great question. Any other question? So sciatica sufferers, people with sciatica, don't always just they feel pain, but they can feel numbness and they can feel tingling as well. So that's part, you want to write that down. Who's felt the numbness or tingling? Anybody felt that? So it's not just the irritating pain that goes down the leg, but also that numbness or tingling or the feeling that your leg is heavy. That is related to the sciatic nerve as well. Okay? So any three of those symptoms are a sign that, okay, this nerve might be getting irritated here. What questions have you got about that? You guys are doing great so far. All right? Okay. So we're going to go back to our little high school anatomy. How do you remember that? Okay. I'm not the artist in my family, but I think I'll do all right here. So bear with me. Can everybody see this blue right here? Okay. We're going to go with this little diagram here. All right, I'll tell you what everything is. Okay. This is a picture of your low back. Okay? Looking this way. How many of you have that little grandchild or son or daughter that you can see the spines on their back, right? They're real skinny, right? That's what these guys are. They're the spines on the back. So who can tell me what this might be? These two things. What are they called? Vertebrae? Anybody else? She's got it. Vertebrae. I just want to see if anybody else had any. Okay? So these are your two vertebrae. And you have 5 low back vertebrae. 1, 2, 3, 4, 5. Okay? So we'll call this L4 and L5. Those are the two most common areas. 98% of the times your sciatica is going to come from L4, L5 region. Okay, the L1, L2, rarely. L3, okay? Or so the research says, okay? When I say these facts, this is all from research, all right? Just as a caveat, all right? I don't just make this stuff up in my head. Okay, so these are 2 vertebrae. Now, what would this little guy be here in the middle of the vertebrae? He's no one other than Michelle. Got disc, very good. All right, so we got the disc here. And then, so what is this important structure running down the vertebrae, going through the canals in the vertebrae?
Spinal cord.
It's a nerve. It's a big nerve. Someone said over here? Spinal cord, yes. So our central command system, the spinal cord, the brain, the central command. I'm doing this right now. Coming from my brain, going to my spinal cord, out to the army of nerves in my arm, telling me to move my hand. Okay? That's how it works. Starts here, down the major cord, branches of nerves come off that cord and tell me to kick my leg out. Tell me to hit myself. Okay? That's how it works. So, off this spinal cord, you've got nerves. Okay? So central command, spinal cord. Now you got nerves coming off. Everybody following right now? I'm not going to go much farther than this, okay? So you got nerves coming off. This is where a sciatic nerve starts. It's a bundle of these nerves clumping together on one side of your back, going down, okay? So that is where the sciatic nerve originates. It's not just, it's a big bundle of nerve, and that's why it's so large. So nerves are like ropes, okay? And they will bundle up, okay? And then go down that's where the sciatic nerve originates. All right? Any questions about that? Okay, so that kind of gives you a better understanding of what is sciatica, where does it start. Now, we'll leave that there for now, okay? So that's all about your high school anatomy. That's all we'll cover for now, okay? Just a quick little bit about my